Another interesting vascular density are the pulmonary varices. In this child, some rounded densities were noted in the right mid-lung field. In this pulmonary arteriogram, the pulmonary arteries were in the venous phase of the pulmonary angiogram, the nodular densities filled and are typical of pulmonary varicosities. Standard tomography revealed vascular structures. At first glance, they may mimic pulmonary artery aneurysms or AV malformations. CT examinations are usually very revealing of these vascular abnormalities. They can be used for the diagnosis of aneurysms, AV malformations, as well as pulmonary varicosities. This is an adult who did not have cardiac disease and showed rounded densities adjacent to the right atrium and faintly seen in the medial aspect of the left lung. A pulmonary arteriogram revealed no abnormality. In the venous phase of the angiogram, we can see dilated veins. These are pulmonary varicosities affecting the two lungs. Quite often, as a result of prolonged pulmonary hypertension due to mitral disease, pulmonary varicosities can develop on an acquired basis. In this patient, we can see a large oval-shaped mass close to the right heart border. What could it be? It could be a pulmonary lesion. Pleural lesion, unlikely. Could it be a mediastinal mass? Also somewhat unlikely. And if it is in the lung, is it parenchymal or is it vascular? A coronal MR examination shows a large mass that corresponds to a varix of right pulmonary veins. Note the proximity of this mass to the entrance of the pulmonary veins in the left atrium. This is a late phase of an injection. In the axial image, note the filling of pulmonary veins, which are markedly dilated. Actually, they represent the varices of right pulmonary vein. In this venous phase of a selective right pulmonary artery injection, note the filling of a large pulmonary varix and the subsequent opacification of the. In this axial MR examination, observe the pulmonary varix, which has a flow void appearance similar to the blood in the left atrium, in the aorta, and in other cardiac chambers. In other words, the mass was not a solid or cystic pulmonary lesion, but it was a vessel, and in this case, a pulmonary varix.